Did you know the highest risk age for heart attacks is around 65 for men and early 70s for women? Not your 40s, not your 50s, right when most people think they're finally slowing down and taking better care of themselves. That's when the danger quietly peaks. And here's the scary part. Most people have absolutely no idea what's happening inside their arteries until it's too late. No warning, no dramatic symptoms, just one day, a little chest tightness walking uphill, shortness of breath carrying groceries, a strange fatigue that doesn't feel normal anymore. Then suddenly your entire life changes with one sentence. You have blockage in your arteries. But what if your body has been trying to warn you for years? What if there was a simple way to check for signs of dangerous plaque buildup at home, using nothing more than a regular blood pressure monitor? Because today I'm going to show you exactly how to do that. And once you understand what arterial plaque really is, you'll never look at heart disease the same way again. Most people think heart attacks happen because cholesterol magically clogs arteries like grease in a kitchen pipe. That's not the full story. The real danger is something much deeper happening inside the walls of your blood vessels. Inflammation, damage, plaque, instability. Think about this for a second. You can feel perfectly fine while dangerous plaque quietly grows inside your arteries for 10, 20, even 30 years. No pain, no symptoms, nothing obvious. Until one day that plaque ruptures like a pimple under the skin. Your body sees that rupture as an emergency and forms a clot. If that clot blocks blood flow to the heart, it becomes a heart attack. If it blocks blood flow to the brain, that becomes a stroke. That's why this matters so much, not fear. Awareness. Because once you understand your risk, you can finally start doing something about it. Now, before we continue, quick warning. If you've been diagnosed with deep vein thrombosis, severe circulation problems, or intense leg pain, skip this home test and speak with your doctor first. For everyone else, let's talk about one of the simplest ways to screen for circulation problems connected to arterial plaque. It's called the ankle brachial index, or ABI. And despite the complicated name, it's surprisingly simple. You're basically comparing blood pressure in your arms versus your ankles. That comparison tells you something incredibly important: how easily blood is moving through your arteries. Because healthy arteries allow strong, smooth blood flow. But narrowed or hardened arteries create resistance, and your legs often show those circulation problems first. That's why people with artery disease frequently notice cold feet, leg cramps while walking, numbness, weakness, hair loss on the legs, slow healing wounds. Your body is literally struggling to deliver blood where it needs to go. Now imagine this. You're sitting at home with a blood pressure monitor, maybe the same one sitting in your bathroom cabinet right now. And within minutes, you could learn whether your circulation may already be showing warning signs. That's powerful. Here's how it works. First, sit or lie down and rest quietly for a few minutes. No rushing around, no climbing stairs right beforehand. You want your body relaxed. Now take your blood pressure on both arms. Write down the top number and the systolic pressure. That's the pressure when your heart pushes blood outward. Then place the cuff around your ankle and repeat the process for both legs. Yes, it can feel a little awkward the first time, but stay with it, because this next step is where everything becomes meaningful. Take the highest systolic number from your ankles, then take the highest systolic number from your arms. Now divide the ankle number by the arm number. That gives you your ABI score. And here's what those numbers generally mean. An ABI between 1.0 and 1.4 usually suggests healthy blood flow. Between 0.9 and 1.0 may still be acceptable. But below 0.8, that may indicate plaque buildup and restricted circulation. And if it's too high and above 1.4, that can point towards stiffened, hardened arteries. In other words, too low is a problem. Too high is also a problem. Now here's what most people don't realize. Your legs often reveal artery disease before your heart does. Why? Because blood has farther to travel there. And leg arteries face more pressure, more gravity, and more wear over time. So if circulation problems show up in your legs, it may also mean plaque exists elsewhere in the body too. That's why doctors take PAD, peripheral artery disease, so seriously. Because it's not just about leg pain, it's about heart attack risk, stroke risk, overall vascular health. And this is where many people get frustrated. They leave the doctor's office with a prescription, but still don't fully understand what's actually happening inside their body. They wonder, why is this happening now? I'm eating better than I did at 30. I thought getting older just meant slowing down. But aging itself is not the full story. Your arteries respond to years of inflammation, blood sugar spikes, smoking, inactivity, poor sleep, stress, and metabolic damage. And the good news, your lifestyle still matters tremendously. Movement matters, food matters, sleep matters, blood sugar matters. Because plaque isn't just about cholesterol. It's about artery health, inflammation, stability, blood flow. And if your ABI results are normal, that's great, but don't use that as permission to ignore your health. Because heart disease often develops quietly long before symptoms appear, and if your results are concerning, please don't panic. This is not about fear. It's about catching problems early enough to change direction. That's the real goal. Awareness before emergency, because your body whispers long before it screams. So now I want to ask you something. Have you ever checked your circulation before? Do your legs cramp while walking? Do your feet get unusually cold? Or have you noticed lower energy lately that just doesn't feel normal? Let me know in the comments below. And if this video helped you understand heart health in a completely different way today, make sure to like, subscribe, and share this with someone over 50 who needs to see it. Because sometimes one simple test can start a life-changing conversation.